Welcome, everyone. We're glad to be with you today. It is September 17th, the middle of September, on a Thursday, and we are really excited to have several individuals with us today to share with you how their sectors are implementing various challenges, how they're responding to and working through some of the challenges that we see with regards to the case increase, and particularly the age group where we see the majority of these cases. So I think it'll be important to hear from these individuals around various sectors in our community to help you all understand that this does spread far and wide in our community, and to hear directly from them. So we will have three speakers today: Dr. Elizabeth Cogbill, who is a physician from Gunderson Health System and specializes in geriatrics. She is also the leader of the long-term care Taskforce. We will also hear from Dr. Erin Engel, who is the superintendent at the La Crosse School District, and also Libby Weber, who is the CEO at Weber Group. And each of these individuals represents a stakeholder group on the Cooley COVID-19 Collaborative. So Dr. Cogbill is one of the representatives from long-term care. Dr. Engel is the public sector or the public schools representative for K through 12 schools, and Libby is one of the representatives from the business sector. So we're so grateful to have you all with us today. And we're going to start with Dr. Elizabeth Cogbill. If you would share with us some of your insights about this topic.
Mm-hmm. Well, I'd first just like to say how grateful I am to be able to speak to the media and directly to our community. Right now, this is not the time to be isolated in our silos, and it's an honor to sit alongside Dr. Engel and Libby and you, Jen, and I truly am grateful for this opportunity right now. So nationally, about 8 in 10 COVID-related deaths are in the older adult population, people age 65 and older. We in La Crosse, we have been very fortunate. We have not had a lot of COVID in our older adult population, and cases in our long-term care facilities. So those are nursing homes and assisted living facilities. Those have been pretty low as well up until now. And we have not seen any deaths in our nursing homes. So those are pretty amazing statistics, and that's a testament to our facilities and the great work that they've been doing, and also our community and the work that everyone has been doing throughout the beginning of the pandemic and the beginning of summer related to COVID. But our nursing homes are fully dependent on our community to serve as our workforce. And this means that right now, in light of this degree of community spread, these older adults are at risk for contracting COVID, and therefore they're at risk for death. And they're also at risk for substandard care. So every staff member who is a high-risk exposure or who is instructed to quarantine or is a close contact is out of work for that period of time. And that the downstream impact of that is that they're not serving our older adults in the facilities. And as an example, just over the past week, we've had multiple facilities in town that have had positive staff. We've also had multiple facilities that now have positive residents at a higher rate than we have seen the entire pandemic. And over this past weekend, we had a couple facilities that on Friday and Saturday had more than 20 staff who were immediately pulled from work to quarantine because they were a close contact or they were positive for COVID. So I guess my point with sharing all of that is that the impact, while it may appear to be sort of contained within an age group or contained in one area in the community, the impact is really enormous, and it's really far-reaching, and it has the potential to have just incredibly, the word terrible comes to mind, but terrible consequences for this population, my patients, the people that I serve. So I guess with all of that, what I really want to say to our community is that you have enormous power right now. You have the power to continue the spread unabated, and it is going to get into our facilities, and it is going to get to our residents, and we will see more deaths among our older adults. But the converse of that is that you also have the power to do great good. You have the power to serve your grandparents and your parents and your loved ones, and to really to benefit this community in sort of an unprecedented, enormous way. And so I just would implore everyone to please please consider what responsibility looks like right now in this time of a pandemic, and to consider that we really are in this together. And I guess we are woven together. We are a fabric, and what's happening in one age group is not isolated, and it truly does spread across the community. So hopefully that was less than 5 minutes. Those are my thoughts related to COVID and long-term care right now.
Appreciate your thoughts, Dr. Cogbill. That was very, very helpful. We'll move next to Dr. Aaron Engel, who is the superintendent for La Crosse School District.
Hello, thank you for the opportunity to speak today. I too am thankful for this opportunity and the partnerships that we've been able to have with the county and the other sectors in our community. You know, the latest outbreak has primarily been among our college age students, that 20 to 29-year-old group. And we do know that, you know, our students in pre-K-12 have had a lower incidence of COVID-19. However, you know, they take home whatever they have to their parents, who are also more vulnerable, and to their grandparents and other people in their extended families. And the 20 to 29-year-old age group does interact in our schools and with our pre-K-12 students on a regular basis, as student teachers, through childcare, surround care, as siblings and friends, and also as parents. This group and everyone who interacts with children have the ability to prevent the spread of COVID and keep our families safe. By wearing masks and socially distancing, that all makes a difference. Additionally, in-person school for our students is important, and especially for our youngest students and our students who are at risk. We know the value of that. Our parents are clamoring for in-person schooling, and we want to provide that as soon as we are able to. We've already seen impacts from this recent outbreak on school-age children through the shutdown of various childcare programs, daytime services through our partners. And we've had cases in our school district already of children who have tested positive. So it's coming to our schools, and it's here, even though the largest group that's affected right now is that 20 to 29-year-old group. If we as a community value the best possible education for our students, we must as a community come together and do what is necessary to reduce the spread of COVID. Wearing masks and social distancing, even though it's not fun and we don't want to do it sometimes, it will reduce the spread of COVID and allow us to provide the best possible education for our students. So thank you so much for doing what you can to prevent the spread of COVID and help us be as safe as we can in our community, for education, for our long-term care facilities, and for our business community.
Thank you, Dr. Engel. Appreciate that. And Libby Weber from Weber Group, who is the business representative to the stakeholder group with the collaborative. Thank you for being here.
Thanks, Jen, and thanks everyone for giving me the opportunity as well to participate in a very important dialogue that I'm impressed that we are doing exactly what the collaborative is set out to do, and that's collaborate. You know, from my perspective and what we're seeing in the business community, we represent a few of the industries of many that are local businesses. And, you know, we talk openly within our own organizations on all our different properties with our teams that really, you know, we think the best way in which this community can help manage and ultimately improve the status of the COVID situation is by sharing in the responsibility. And everyone really has a role to play, and we're seeing that in practice. We talk about it a lot within the organization. Business owners especially can help ensure that their workplaces are as safe as possible by following the guidelines that are set forth by public administrators and officials. Employees can help by being responsible and making good decisions so that they don't jeopardize the stability of your employers and increasing the exposure and spread within a workplace. And the public as consumers, you know, we ask that you continue to be patient with businesses and organizations as they really do their best to try to help make the best operational decisions that are good for their own needs, as well as hopefully helping to support the health and safety of the community. Specifically, as we're seeing, you know, an increase in the cases as of late, and in that 20 to 29-year-old demographic, That's a sector that provides such a huge value in our community. They are students that work in our businesses. They have families that come to visit. They are young professionals that make up a significant, healthy portion of our workforce. And this demographic can really help influence our business community and as they participate as employees, but also as consumers. And so keeping them healthy will help, I really believe, keep everyone else healthy. Stable business operations are really dependent on a healthy and stable workforce. When that stability is at risk, it really kind of culminates into a lot of new risk factors that include, additional lost revenues. A lot of businesses in different sectors are already struggling to recuperate from a disrupted business from 2020 in the pandemic. But it can ultimately compromise available work to their coworkers and to their families, which everyone's is then affected by opportunity for a stable income, eligibility with working hours to make sure that they still apply for health insurance and other benefits that might be offered by their providers. So really kind of building and maintaining that stability within the workforce will help keep the business community stable in itself. And so I feel that, this community really needs to continue to empower those that are following the guidelines and are really making the best decisions that they can to help ensure that they're providing safe places to work, safe places to their consumers, but also, continuing to share in that responsibility that really everyone has a role to play in helping us improve the overall situation.
And I'll just kind of wrap it up in a summary, and then we'll take questions from our media partners. But one of the themes that I hear from all of you is that this is a lift that we have to do together, and this is there are actions and decisions that every member of our community can make that can help not only protect themselves and their families, but also what's happening in each of the sectors that you describe, in nursing homes, assisted living facilities, and K-12 schools, so that our kids can get an education and the staff there can be protected and supported and healthy, and in our businesses to keep our economy vibrant and healthy. So these are really important aspects of our community, and we have the ability to take action and do the right thing and follow these guidelines and recommendations to really do this lift together. So I think that's fairly empowering to the individuals that we are speaking to right now, sharing this message with, to say, this is something that is really important, and we need to take this seriously so that we can come through this on the other side in a positive way. So thank you so much for all of your words and insights that you've shared. I will now open it up for our media partners to ask questions.
Hey, this is Mike Biermeister with WXOW News 19. What are some ways that the collaborative is working to truly change the behavior of 20 to 29-year-olds? Because we've seen it all across the country. I mean, it's definitely, the messaging has been out there, but it seems like it's not hitting. What are some specific ways that we're going about trying to change that behavior?
Well, I'll start, and then others can join in if they have additional thoughts about this question. First of all, it starts with understanding. And yesterday, the collaborative met with Western Technical College, Viterbo, and UW-La Crosse to learn more about all the things that they're doing already. They are closest to this population, and they are working very hard in a number of areas to include messaging. And they do have a unique position to message to this population. But it isn't just the 20 to 29-year-olds. It is also their parents and their community in which they live and where they work. So those messages have to be spread across all of those. And again, not just 20 to 29-year-olds, all of us have to take these actions to support the overall community health and well-being in this fight against COVID. Others that would like to give any thoughts?
Hi, everybody. I'm Isabella Holsizer, WKBT News 8. My question is, what is all of your reaction to the New York Times article that listed us as a hotspot?
Well, I can start with that question again if others have insights. That is not a place where we want to be in La Crosse County. We don't want to be number 1 for the fastest growing rate. We don't want to be number 16 for the current rate. Those are not places where we want to be. But what I can tell you is that that's where we are. And so where we are is where we need to start from. And in that frame, I look at all of those that are working really hard, not just in the health department and the collaborative, but our partners in businesses and in K through 12 schools and in long-term care settings and in higher ed, all of the planning and implementing of those plans to the best of our abilities. It is not going to be perfect. But it is very important to understand that just because that's where we are today doesn't mean we have to stay on that same track. And that is the message and the point today, is to engage all of you as our community partners and our community members to say, now is the time. If you have not been following those recommendations, we need you to start following them. Not for us, but for you and for the rest of our community, and encourage your friends and family to follow them as well, because that's, again, how we're going to get through this and get to the peak of this surge and to move past it, and to be able to look back on this and say, I'm glad we got through that. Again, as a reminder, we are fighting against a virus, not against each other. And it is so important for us to remember kindness and patience and flexibility, things that are just really should be core to our nature. And the virus is really, gives us the chance to really bring that out, and to really take the power back and to be empowered to make the decisions that we need to make to support our community, to include wearing masks and not having social gatherings right now, and making sure that we're not going to work or going to school, or going anywhere for that matter if we have any symptoms, even if we think they're mild. So those are just a sample of examples that I think we really need to be working together on. Any other thoughts?
I can just say something briefly in terms of my reaction to that article. I think the 2 words that come to mind are fear and hope. As a physician, I see that and I'm fearful for my patients. I'm fearful for the impact on the healthcare system, but I also live in La Crosse and I love La Crosse and I know this community, and this is an incredible community to be a part of, with very engaged across all age groups and all sectors. And so the hope is that we see this as truly an opportunity to change that trajectory in a really remarkable way. And so both of those things, fear and hope, sort of parallel, or my reactions to that article.
I would say my reaction to that article, Isabella, was pretty much it's indisputable motivation for us to keep moving forward, and to strengthen the support that we have within the community, rely on each other, find the resources that we need to better do our jobs, and make sure that we are setting up a healthy structure for others to continue to live and work in the community, but doing it safely, smartly. You can't really defend what you're seeing in the New York Times, especially with alarming data like that. But I think if that serves any good purpose, it's to continue to motivate, the good work that everyone's trying to put forth.
Hey, it's Rick at WIZM. What's around the corner due to the rise in cases? Are we already seeing this? Are there more hospitalizations already? Can we expect more deaths or more deaths, I guess, and anything else? Can we expect anything else from the rise in cases?
Yeah, so Rick, this is a very good question. It is very hard to project exactly what will happen, but I think there is concern. There is a level of concern in the conversations with the collaborative about increased rates of hospitalizations. We aren't seeing drastic changes there yet, but we also know that hospitalization rates typically are a couple of weeks behind rate increases like this, especially in a population that's generally healthy. Again, we're worried mostly about the spread from this population. Many of these folks that are current positive cases are mildly or not symptomatic, which is wonderful. Except that, that population then can spread it to others that might have more significant impacts, both on their own health as well as the health of others as it relates to the spread of COVID. So I do think there is concern about increased hospitalizations in the next few weeks. I also think that the potential for deaths in our community members is definitely there, depending upon whether or not we can take action now to reduce the spread and contain where it is right now. Any other thoughts on that?
I would also add that, our returning to school is contingent on the conditions in the community. We're following the Harvard Global Health Institute's model as best we can, using those metrics. And as long as the conditions in the community continue to stay at this, really high level, we're not going to be able to safely return students and staff to school. And so the sooner we get this under control, the sooner we're able to implement the measures we all know are necessary, the sooner we'll get our students and our most vulnerable students back in school learning where they often learn best.
Hey, this is Mike again. In terms of the business sector, whether it's a restaurant or bar, are there any new strategies that are being implemented due to this spike to kind of help curb the spread right now?
Mike, I would say, we're really kind of in a challenging position of already working with many of the industries that you had mentioned are kind of forced to operate very lean. There was a lot of lost revenue for several months, and kind of recuperating that revenue helps, financially keep businesses afloat if, labor is cut and hours of operation are adjusted. And so finding the balance of knowing what a business owner needs to do to keep your business up and running in a healthy way, but also by, working within the confinements of, just the guidelines that we're trying to be safe with. So every business owner is different, and I respect anyone who, is trying to make the best decisions for their businesses. That's exactly what they are experts at, are their own businesses. A lot of us are not public health officials. A lot of businesses, especially in the local downtown La Crosse area, don't have their own human resources departments. And so this is a lot of new stuff to have to kind of figure out and make decisions on. And, the number one strategy, I think, is just trying to educate yourself the best you can, and to stay engaged in conversations and learn the most you can so you can make the best decisions. We've tried to implement different staffing strategies based off of just staff availability. Quarantining really kind of throws restaurant industry, hospitality industry, the retail industry for a loop, especially when you have kind of mid-management that are affected. If you don't have managers available to work, you might not be able to open for a shift. So it's, different staffing and scheduling strategies have helped. But at the end of the day, when you're affected by positive cases in your own workforce and you have close contacts to quarantine, sometimes all those strategies just don't work. So, remaining responsive quickly and creatively is really kind of the best approach. And I think the longer we get into the, pandemic and the certain level of increases right now, I think we're more comfortable and confident in knowing that we can make those decisions more quickly. And so it's a challenge every day, every shift, every business, every sector has their own set of unique challenges, but really, focusing on having an available and healthy workforce, I think, is kind of the foundation of making sure that the business community can stay afloat.
Isabella Holsizer, WKBT again. This one's more directed towards Aaron. So West Salem School District is going online again starting Monday, and they have reported that they've only had 2 cases, but that was prior to in-person classes. Are you able to explain why that they're going back online again?
I don't know the exact circumstances. I work for the School District of La Crosse, not West Salem, and I would hate to speak for them, but I think the conditions in the county speak for themselves. With this drastic increase, it's just not as safe as it was, a couple of weeks ago. At the start of the school year, we were really hopeful that with the low case rates, if that continued, we'd be able to return to in-person learning. West Salem, made an attempt to do that, having seen those lower case rates, but now things have changed drastically. And so I think they're responding to the conditions in the community just like we are. And, looking at this increased risk to all of the people in our community and trying to be a good partner in preventing that spread.
Do we have any other questions for our panelists today from the media? Looks like we have one more from Isabella at WKBT.
One more, sorry everybody. So do you kind of have a grasp for how many college students tested positive? Because I know that you report what UWL, their campus testing, but let's say that there is a student living off campus that tests positive. Is there a way to know that complete number so it kind of gives the university a more complete picture?
Yeah, so that is a tough question. We have really a couple of different data points. One is what the University of La Crosse reports as it relates to both their antigen and PCR testing. The other measure that we have is the overall picture in the county with the numbers that are in that age group, which again, you can find on the case data page of the Cooley COVID-19.org web resource. Again, the case data page will help you identify what that breakdown is for age groups.
I'm not seeing any other questions from our media today.
Okay, well, I'm gonna wrap it up here by I'm gonna use Libby's indisputable motivation. I really liked that, Libby. I would extend an indisputable motivation to our community members to ask you all to take this as our chance to shine as La Crosse County. Instead of being number one for the increasing case rate in the nation, let's be number one for being motivated to take the recommended actions right now to help reduce this case rate in the next 1 to 2 weeks, because what we do now will impact us very positively if we take those actions, not so positively if we don't. So we can all be empowered by the message today. And I also want to just thank all of our panelists. I think that it's really helpful to our community and to myself to hear from each of you and what's happening from your viewpoints. These are all very important aspects of our community as a whole. So I think the message today was just really powerful, and I want to thank you all for being present. And thank you to our media partners as well for continuing to provide accurate information to our community. And again, just leave with a thank you to all of our community members who are already doing the right thing. Please continue to do that. And anyone who hasn't taken that opportunity, now is the time. And we all encourage you to do that so that we can work together to stop the spread of COVID-19 in La Crosse County and beyond. Thank you so much.